lights haven't been turned off?
Please introduce yourself.
Me, Nazarov, my mother, if I'm not mistaken. I'm a skater, I'm a hyper engineer, I'm a teacher, I work in practical methods and at URU.
How old are you?
I am currently 73 years old, and for the past 16 long years, I have been consistently receiving this specialized extracorporeal blood treatment entirely on my own.
Tell me, how old do you actually feel inside?
I honestly feel like I'm 55 years old, each and every single day. This is what is commonly referred to as an adaptation line in this context. That is, it's the normal response for physiological, psychological reactions in pilus dyskinesia.
How often do you undergo extracorporeal blood treatment?
Yes, I receive it 3 times a day. That is 4 procedures, 3 to 4 procedures. The history of this method, which was invented by Professor Simonovsky at the Ministry of Training and Education, begins in the 1910s of our century. This method was developed in response to the desire of doctors and atomic therapy patients to solve the problem of the time required for chemotherapy. Usually in atomic therapy, there are 10 to 15 recurrences. That's all. So you have to come to Lila 10 to 15 times. And that's why everyone still wanted to do these procedures in a single session. But for that, it was necessary to make a collar of a large diameter, and that's exactly what was done. Billy Uboichi called this method TEBOO, under the name with the decoding, so to speak, the corporeal sphere of the nation and examination of blood freezing.
Are there other methods for processing large volumes of blood?
Yes, there are methods based on the use of wick-type hydrogen devices. The whole problem here is exactly how to handle blood gases. So we apply the method developed by Professor Bochi. That is, only ozone-resistant materials are used, but there are other methods as well. They are currently used in several devices recognized worldwide and are built on a filter for general.
Why do you use this particular method?
Well, in this regard, we are followers of the chronic worker, as I already mentioned. He did not allow the use of this procedure, which is essentially blood surgery. The materials in particular from which the components are made, both visually, fundamentally, and so on, that is to say, their ozone resistance, strictly speaking, is not proven. Therefore, I believe this is rather the highest standard for this procedure. And the founder of this method is much. And so, within this same approach, we strive to follow it, to protect not only the body from the products of destruction, from the byproducts released from various materials, but also the patient themselves. That is, I evaluate the antioxidant radar in water as part of the ozone-oxygen mixture. And also, the end patient usually inhales hydrogen to protect themselves during the procedure. We protect the patient's blood by supplying hydrogen into the rotating branch contact, and we protect their body from the oxidizing agent from the alkali. This hydrogen inhalation is very helpful. It relieves pain in the leg,